I'm Lila Lazarus. When's the last time you went to the dentist? During the pandemic, older adults delayed their dental care more than any other health care. And sometimes it's a lack of transportation, sometimes it's a lack of dental coverage. But no matter how old you are, you can still get cavities. You can still have tooth decay. You can still get gum disease. And the older you get, the more likely it is that you're losing your teeth, which leads to a whole host of problems. So, here with a reminder about the importance of your teeth, no matter how old you are, is Dr. Bruce Smoler of Smoler Smiles Family and Implant Dentistry. Good to see you again and to see your smile. As we get older, and it's hard to believe how fast that happens, we still get cavities.
Absolutely. The old adage, you get longer in the tooth, that actually is true because as you lose support for teeth, gums recede. And so it's a combination of if you just lose gum support, then the tooth actually will look longer. So you get long in the tooth. And then there's also the situation where you could get bone loss, which loosens the tooth. Patients will come in, they try their best to save teeth, but sometimes the teeth just aren't worth saving. You're sometimes better off in just fixing everything at one time. And it's sort of like that saying, if you want it done once and do it right, dental implant reconstruction seems to be the best route for many of our patients.
How many people are missing a tooth or all their teeth? How prevalent is it? And what age do you really see it start to happen?
But would you believe that there are more people in this country with missing teeth than the population of Canada?
What's Canada doing that we're not doing? And are they looking at us going, tooth decay, eh? Like, what's the problem? What are we doing right?
Well, tens of millions of people are missing teeth. It is the silent epidemic. Well, getting dentures for some people seems like the best option. Now they're going to struggle for 10, 20, 30 years trying to have dentures make them feel whole again, and they just can't do that. It really affects their self-esteem. People with dentures, on average, live 10 years less than someone who has a healthy, normal bite. Without being able to chew, you're going to have a higher incidence of colon cancers, polyps, GI disorders, all because you can't chew. Not being able to smile, not being able to live the life that they've wanted to. It's just so devastating. People become shut-ins. People don't look at people in the eye because they're embarrassed.
So it used to be you'd take a dental impression, then you'd send them to the lab, create a surgical guide. This took a lot of time.
Right.
But now with a robot, you can plan and execute a procedure in the same day.
We're the first in Michigan to offer this service where it's robotic assisted dental implant surgery, more precise than the human hand. We do things now in minutes that used to take hours. No stitches, no incisions. It takes me on average 15 minutes of surgery, which used to take 4 to 5 hours.
So, as good of a dentist as you were before, can we honestly say the robots made you better?
So I've actually used the robot on myself.
How did it go? Do you still have teeth?
I do. In 3 dimensions, you can only place the implant where you predetermined it to go.
There are so many people listening who have issues with their mouth and have delayed dental care. Maybe they're getting older. Maybe they know how important their teeth are, but they're not taking care of it. What do you want to say to them?
But imagine what life will be like to be able to chew, eating the foods you've missed eating for decades, of smiling, of talking comfortably, of being able to give to your loved ones a smile. So many people are missing out and are shut-ins, all because they don't have the confidence to look at someone and smile.
I always find it so sad when someone's laughing or smiling, but covering their mouth so that people don't see either the teeth they have or the teeth that are missing. Thank you so much for keeping people smiling for as long as they can.
Well, thank you, Lila. We're only a phone call away. Check us out. We're here to help. Thank you so much.
Bye-bye. Make sure you check out Gracefully Graying on Facebook, Instagram, Twitter, LinkedIn, YouTube, or at the website gracefullygraying.com.